When I was asked to do this, I didn't know that Dr. Gambara was going to talk about uric acid stones. And of all the areas of metabolic stone disease that I chose to speak about, I chose uric acid. But I'm going to be talking about different aspects of that, so it's not exactly a copy of what Professor Gambara was saying. Just to remind you what the main risk factors are for uric acid stone disease, there are three main factors in urine. That is high acidity of the urine, high uric acid excretion, and low urine volume. And these are some of the clinical areas where you might find these situations. When you look at stone disease on a world scale, I want to concentrate first of all on the very high uric acid stone problem in the oil-rich Gulf states in the Middle East. And here you can see what the problem is. If you look at this center panel here, this is the percentage of stones which are predominantly uric acid in the populations there. And these are all data from the last part of the last century or just the beginning of this century. And when you look at the UK, way back in 1975, we had only 4.5% of our stones were predominantly uric acid. Whereas in the Middle East, you can see that they're around 15%. So there's a much, much higher incidence of uric acid stone disease in the Middle East. We'll come back to the UK data later on in the talk. So why has there been this increase in the incidence of uric acid stones in different parts of the world during the last 30 to 40 years? Well, first of all, if you look at the incidence of stones in the Middle East compared with the UK, this is the lifetime expectancy of men forming stones by the time they reach the age of 60 or 70 in various countries in the world. In the UK, you can see that's we'd expect about 8% of men to have formed a stone by the time they've reached the age of 60 or 70, whereas in all the oil-rich Gulf states, KSA is the Kingdom of Saudi Arabia, then you've Kuwait and United Arab Emirates. You can see that that figure's up around 20%, so a much, much higher incidence of stones in that part of the world. When you look at the diet in the Middle East compared with in the UK, here's the animal protein consumption, which you can see is much, much higher than in the UK, and in fact even slightly higher than in the United States. And when I was doing diet histories on the Middle Eastern stone formers in Riyadh when I was working there, they were eating meat or fish or poultry 3 times a day. So the purine intake was also very high. We'll leave the calcium and the oxalate story for another time. So the adverse effects of a high animal protein diet, we did studies many years ago in Leeds on this, and we know that 5 out of the 7 risk factors that I talked about yesterday for calcium and uric acid stone disease are adversely affected by a high animal protein diet. But the ones that are relevant to this talk today are that, of course, a high animal protein diet is a high acid ash diet, so it tends to acidify urine. Also, as I've just shown you, it is a high purine diet, and therefore you will get a high uric acid excretion. So a high animal protein diet is going to increase your risk of uric acid stones. And this is what happened to urine composition when you compare stone formers and normals in the UK and in Saudi Arabia. You can see that the urine volumes, first of all, were a little bit lower in Saudi Arabia because of the very hot, dry climate in Riyadh. The urines were much more acidic than the urines in the UK and in the comparable groups, and the uric acid excretions were much higher. So there is obviously a tendency to form more uric acid stones, and when you calculate the probability of forming stones in the the Middle Eastern stone formers, you can see that the PSF values are nearly all above 0.5 in the stone forming group. So they're clearly, on my definition anyway, at high risk of forming uric acid stones. So then we have, this is the main reason, that a very affluent society is more likely to eat a diet which is rich in meat, fish and poultry, and then there's a strong correlation with uric acid stone formation for that reason in the oil-rich Gulf states. Coming back to the risk factors again for forming uric acid stones, there are various possible factors. The high acidity may be due to either the acidogenic diet, or it may be due to, for example, poor buffering of hydrogen ion excretion in the kidney. And the high uric acid excretion, as I've just shown, will be due to the high purine intake. So here we have the bad Middle Eastern diet, a high animal protein that I've shown you, which increases uric acid excretion, acidifies the urine. You have a low urine volume because of the environment that they're living in. You get a low citrate because the acid urine reduces citrate excretion, and you've got a very high oxalate excretion for reasons I won't go into just now. So when you put that combination together, this explains why there's a very high prevalence of uric acid and calcium oxalate stones in the Middle East. So when you add to that the low calcium diet, which we also found in the Middle East, and the very high oxalate intake, this gives them a very high oxalate absorption in the gut, which further increases urinary oxalate. And when you put the insufficient fluid for living in a hot climate and the mild dehydration, then that lowers urine volume and again contributes to the problem. Coming back to the UK now, if you look at the last two columns here, which compares stone composition in UK in the 1970s and more recently, you can see that there's been an enormous increase in uric acid stones in the UK during that time, and that's been reported in many countries in the West. So what is the reason for that? Well, I think the main problem is, or has been identified, the Dallas group have done a lot on this, as well as many other groups, have shown that metabolic syndrome is one of the main problems for that. Metabolic syndrome, of course, being a combination of being obese and having hypertension and type 2 diabetes. And when you look at our uric acid stone formers in the UK and compare them with our idiopathic calcium stone formers, you can see that as a group, the uric acid stone formers had higher BMIs, they had a higher incidence of type 2 diabetes, and they had a slightly higher incidence of hypertension as well. So in our uric acid stone formers, there's clearly more risk of metabolic syndrome. Now, what effect does metabolic syndrome have on the urine that is causing the risk of uric acid stones to increase? Now, because we do diet histories at the same time as the urine collections, and from the potential renal acid load that we can calculate from the diet, we can predict what urine pH should be. And when you compare the predicted value here with the actual measured value in the 24-hour urine, you can see that for the idiopathic stone formers here, most of them lie on the 1-to-1 line. So we're predicting from the diet what the urine pH should be. However, the patients with the metabolic syndrome, you can see in the orange dots here, are passing urines which are more acidic than you would expect just from the composition of the diet. So we want to know what's causing that. So there are four possibilities. One is that they're consuming a higher acid-ash diet, or that they're obese, or that it's due to aging, or to inadequate renal ammoniogenesis to buffer hydrogen ion excretion. So let's look at the first of these. And here are the data from the same group. This is showing urinary uric acid excretion in relation to meat, fish, and poultry consumption. And you can see that the metabolic syndrome patients are actually lying in the same line as the rest of the idiopathic calcium stone formers. So there's the fact they've got more acid urines is not entirely or really due to them consuming more meat, fish, and poultry than the calcium stone formers. So that's a different picture from the Middle East. So we then looked at the effect of that on 24-hour urine pH. A high acidogenic diet, as I said earlier, of eating more meat, fish, and poultry will acidify your urine, as shown here. And you can see here then that the metabolic syndrome stone formers actually have a more acid urine than you would expect from their diet. So their acid urine is not just due to the high protein, meat, fish, and poultry protein intake that they're consuming. So it's not that that's causing the high acid urine. So is it obesity? Because there is well reported by a number of groups that as you increase body mass index, urine becomes more acidic. But again, the metabolic syndrome patients have a more acid urine than you would expect from their BMI. So it's not that that's causing it. Is it aging? There is a weak inverse relationship between age and 24-hour urine pH. As we get older, urine becomes slightly more acidic. And again, the metabolic syndrome patients are below the mean line. So that aging is not the cause, particularly of their more acid urines. So finally, is it due to inadequate buffering in the kidney? So here are the data plotted from not from the 24-hour urines on these patients, but from a spot urine taken in the morning from the patients. And these are plotted, this is the urine ammonium excretion in relation to urinary pH. And the lines show the original data from Gutman and Yee way back in 1965 in the American Journal of Medicine. That shows the normal relationship between these two variables. In other words, the more acid you're trying to excrete in the urine, the kidney produces more ammonia to buffer that hydrogen ion excretion, and so you get this inverse relationship. The idiopathic calcium stone formers nearly all lie in that area, so their renal ammoniogenesis would appear to be normal. But the metabolic syndrome patients all have much lower ammonia in their urine than you would expect from the pH of the urine. So there does appear to be some impairment of renal ammoniogenesis in these patients, and that is what is causing their urine to become more acidic. So finally then, to sum up, we have metabolic syndrome. The main problem now appears to be of the three components of metabolic syndrome. It's the type 2 diabetes, which there is some evidence that in other areas that there is impaired renal production of ammonia. This produces a more acid urine than expected and an increased risk of uric acid stones. So here we have a summary now of the bad Western diet. So a high animal protein diet, as I showed you earlier, will produce these 5 abnormal factors in urine. If you add on top of that a high fat diet, which increases body mass index, and that has an effect on pH, as I showed you, then if you add on top of that a high refined sugar diet, which we all know about, that increases the risk of type 2 diabetes. Sugar will also increase calcium absorption in the gut and tend to increase the hypercalciuria. And finally, the type 2 diabetes that I've just shown you will decrease the ammonia in the urine, and that will acidify urine even further. And then the final part of the bad Western diet is, of course, high salt intake, which increases the risk of hypertension. That, in turn, will increase risk of increased urinary calcium. And so you have all the components here of metabolic syndrome in place due to the bad Western diet, and that increases the risk of both uric acid and calcium oxalate stones. Thank you very much.